Amanda Moeller. I'm an AEMT with the City of Burlington Fire Department, and today we're going to be covering how to take a blood sugar reading from a person or a patient. So we're going to cover the procedure itself as well as what normal ranges of blood sugar reading should be. Typically a blood sugar reading under 140 is normal. Over 200 is considered to be high. Typically folks that have a blood sugar that goes under 60, those folks or patients can experience a loss of consciousness, altered level of consciousness, or just acting abnormally. Each person, each human is different based on their size, their weight, and the type of diabetic they are. There are two types of diabetics. Type 1 are insulin-dependent diabetics, and type 2 do not require insulin but do have to manage their sugars. Different ways that you would treat low blood sugar or hypoglycemia involves starting an IV and giving D10 or dextrose or D50, as well as oral glucose, or having a person consume orange juice, toast, things with high sugar content, Coca-Cola, and that's for low blood sugar. Folks with high blood sugar or diabetic comas from being hyperglycemic or having high blood sugar would need to be treated with fluids and flushing out the system in a different way to clear some of those toxins. So that's a little bit about diabetics, blood sugar, and some of the information pertaining to that. This is a glucometer. I'm going to now jump into the ambulance here and actually walk through the actual steps of obtaining a blood sugar reading. First of all, you should wear rubber gloves and a mask in COVID times. Here's the glucometer I was telling you about. Most glucometers come in a case. This is the actual meter itself. And these are the glucometer strips. One of the things you should always check before taking a blood sugar is to make sure that the strips that you have are not expired. These expire in 2022, so we're good to go. Each glucometer functions a little differently. Make sure you're familiar with the one that you have or the one that you're going to use. Many different brands basically function in the same manner. So I am going to start with putting my gloves on to make sure that we're safe, sanitary, and do not transmit any diseases. There's another lesson for bloodborne diseases that we won't get to today. Starting with the glucometer, first step for us is to turn it on. It'll kind of go through its thinking. We'll show the last blood sugar reading obtained, those kind of things, has the date, all of that. The next thing is to put the strip into the glucometer. Again, they're all a little different, so making sure that you put it in the right way. This one just slides into the machine and it starts beeping, blinking, so that you know that it's ready for blood, the little drop that keeps appearing. It's helpful to have a Band-Aid, a gauze pad, and an alcohol wipe ready to go prior to the patient contact. And then you'll need a lancet or some kind of device to puncture the skin. You can do a blood sugar check on any finger, hand, toe, whatever you have available. Typically a ring finger or pinky, one of the fingers that you're not going to use in your everyday activities, is a good choice because it can be painful depending on the person. So the first thing you're going to do is take your alcohol prep and clean the area. You can scrub down, up and down for a little while, but essentially I always go around in a circle to kind of keep you're cleaning from the inside out to keep the dirt from going back over what you've already cleaned. It's very important that you allow the rubbing alcohol to dry. Otherwise, when you puncture the skin with the lancet, it's going to burn. You just hold that there. Different types of lancets, depending again on the manufacturer or what the patient or person has at home. This one is a twist lancet. Twist it off and do it that way. So once you've got your lancet ready, you've cleaned your area, you haven't touched it repeatedly since cleaning it, the alcohol has dried, then you can puncture the skin. Little poke, I usually will prep the person for that so that they're aware that it's coming. You may have to squeeze harder on the skin depending if they bleed a lot or not. Resetting my glucometer here. This patient does have good blood flow, good circulation. So I'm going to squeeze a little bit, then I'm going to take the gauze pad to wipe away that initial sample. Then squeeze again, and I'm going to grab my glucometer and just put it up to the little bit of blood that's there. You'll hear your glucometer make a sound or accept that it has enough blood. In this case, this person's blood sugar is 85. 85 falls into our normal ranges under that 140, which is a good blood sugar reading. Finally, so the patient doesn't bleed to death, you want to give them a Band-Aid. So just putting a Band-Aid on the puncture, and then you're done. So that is basically how to obtain a blood sugar reading on a patient or person. Some things that are important related to this is when the last time they ate was, and what's normal for them. As I stated, some folks have blood sugar readings at 40 and they can still talk and are oriented just fine. Others may drop to 70 or so and they will have an altered level of consciousness. Blood sugar can be a very scary thing. It can cause seizures, comas, injury with a loss of consciousness, so it definitely needs to be monitored. Most people know that they're a diabetic or know that that's something that they have to monitor and that they have issues with. Most departments also have protocol on diabetic emergencies regarding high blood sugar and low blood sugar. Let me hand you that. Here at our fire department, we have protocols for diabetic emergencies and how to deal with those. We have, for example, our information on hypoglycemia can be found here. That's the low blood sugar. Again, it talks about obtaining a blood sugar reading and trying to give oral glucose, dextrose, or trying to get the patient to consume food or beverage. It's very important not to try to give patients that are altered food or beverage when they can't swallow so that they don't aspirate and choke. So that's something that's also stated here. If there's an advanced EMT available to start an IV on a person, we can give D10 that way or D50 that way. If you're unable to obtain an IV or IV access, which sometimes is a thing for folks that are diabetics because they do have a lot of medical treatments and doctor's appointments, things where their veins are being accessed. If you have an unresponsive patient, we are also allowed to drill into the patient with an EZ-IO or a drill to push fluid and sugar that way. So again, just kind of covering protocol today on diabetic emergencies and how to take a blood sugar reading. Be familiar with the equipment that you have on your rig and be familiar with your protocols.